The change took effect today in 15 counties.
In the red areas there on that map, indoor dining is shut down while stores, venues, and social gatherings are under stricter limits. So the question is, how did we get here?
Now, Oregon health officials point to 5 straight weeks of sharply rising cases. Oregon now leads the nation for case rate growth.
Fox 12's Brenna Kelly is helping us understand what triggered this move backwards and where we go from here. Brenna?
Well, the statistics do not look good. You might be wondering how we made such a steep increase in cases seeming. We've heard throughout the pandemic, Oregon has been a top performer in case counts and managing surges. But now, the state has the fastest growing case rate in the nation. The governor said it's the 5th straight week the state has recorded increases of 20% or more. And although fewer seniors are being hospitalized, the virus in ages 18 to 34 has increased by almost 50%. We heard from 15-year-old Mariana Robbins at the press conference who's battling long-haul COVID.
I was severely affected in many ways. My ability to learn was impacted, my memory loss, dizziness, daily migraines, and the worst pain I ever felt all over my body.
The lead data scientist in OHSU's Business Intelligence Unit, Dr. Peter Graven, studies trends to forecast health and operational outcomes. He says we already know a shutdown can be effective, and if we do nothing at this pivotal point right now, 176 Oregonians could die from the virus in the next several weeks. More than 700 would likely be hospitalized.
If you look at the history of the census, this is almost exactly the same point in the curve before where we announced the social pause and the freeze. So it's in a very equivalent point in the acceleration.
Graven says shutting down now means there's just 3 to 4 more weeks until vaccines catch up and can get ahead of these widespread variants. The governor is targeting mid to late June to reopen the economy. And as you've heard the statistics, they don't look good. You might be wondering how we made such a steep increase in cases seemingly so quickly. And there you have it. I explained to you why it might be so confusing to still understand why this is happening when still more than half of Oregonians have received at least their first vaccine dose. The governor is urging everyone to get their vaccine. Health officials acknowledged it may still be tough to find an appointment in your area. Dr. Dana Harganani, OHA's chief medical officer, says they are in a logistical phase right now, actively working on moving doses to where there's strong demand. Over the next 4 weeks, you may find mass vaccination sites scaling down and more primary care providers with the vaccine. Reporting live in studio tonight, Brenna Kelly, Fox 12 Oregon.